Work with us call to council on cuts. The stark realities of what the current government reforms of care and benefit mean for Shropshire were spelled out at a recent meeting of the county's new carers group, Shropshire Carers Together, meeting in Shrewsbury. Guest speaker Heather Osborne, Chief Executive of Age UK Shropshire, Telford and Wrekin, told an audience of carers that everyone involved in the care and support system, users, their families and carers, and Shropshire Council itself, were caught up in the cycle of cuts. She said that in addition to the current 20% reduction in funding that the voluntary sector had received over the last 2 years, another 25% was now proposed to be chopped. In addition, Shropshire Council is facing a reduction in its adult social care budget of £24.5 million out of a budget of £98 million, a quarter of the entire adult social care budget. I don't know how they're going to do it, but it's going to be very, very serious impact, she said. Heather Osborne stressed that she was not attacking the council, which was trying to respond to the impossible circumstances in which it found itself. We are asking the council to reconsider, to look for ways to work with the voluntary sector rather than see us as some sort of opponent. This is a terrible situation that we all face, including the council, but equally it would be impossible for the voluntary sector to make up the gap that was being created, because a 25% cut in funding for the voluntary sector itself is also on the cards. She said Shropshire Council was proposing to group funding under 6 headings for the purpose of future funding allocations and to reduce the number of contracts, encouraging voluntary organisations to group together to tender for these contracts. The council has said it will increasingly rely on voluntary organisations to help it meet its obligations, yet at the same time the number of grants it awards to the voluntary sector, an important income source for voluntary groups, is threatened with major cutbacks, and a move from grants to contracts, a very different type of arrangement for many voluntary organisations, Heather Osborne said. At the moment, all this is in the Shropshire Council discussion paper, and I urge you to respond clearly to the paper. It is crucial that groups like this one should make their views known. Taking her own organisation, Age UK, as an example, she said that they could not reduce spending by another 25% without impacting on frontline services. Mergers, or at least joint ventures, between smaller voluntary groups are inevitable, she continued, and some would even struggle to survive. We at Age UK are asking the council to reconsider its approach and not put the sector through a costly and difficult tendering process, which many organisations will struggle to achieve, but to work with us to try and achieve a way forward. It is vital that voluntary community organisations, large and small, made their views known now before it's too late. And she added that time is short. If you value the service that your local voluntary sector provides to you, lobby your local councillors and let them know how much the services mean to you and the impact they have on your lives. Call to action brings strong local response. The second guest speaker at the Shropshire Carers Together meeting was Karen Higgins of the Shropshire Clinical Commissioning Group, whose central theme was the involvement of individuals in the many changes that are taking place in the NHS. She focused on the Call to Action campaign, a national debate led by NHS England. Locally, Shropshire and Telford and Wrekin clinical commissioning groups have been calling on patients, the public, staff and stakeholders to discuss the future of the NHS, not just hospital services, but the local NHS as a whole. They've been attending meetings with voluntary groups and the public to gather comments and experiences, and people have also been able to go online and fill in their survey by visiting either www.telfordccg.nhs.uk or www.shropshireccg.nhs.uk. Karen Higgins said the Call to Action survey had recently closed, but from the strong local response, some 3,000, it had already emerged that the access to GPs was one of the most significant factors in the public mind. She spelled out the connection between local GP surgeries and hospital A&Es. If people can't get access to their GP, they will go to A&E, and that is not what A&E is for. Some 20% of people who use A&E don't need to be there. It would make a big difference if we could get the worried well out of the system. she was able to reassure the audience that, contrary to press reports, there was absolutely no truth in rumours that either Shrewsbury or Telford A&E would close.